Hello, I'm Dr. Chukuma Ubina, a first year resident from Texas Tech Psychiatry, and you're welcome to our Mental Health Minutes. Today we'll be talking about suicide prevention. So, why does it really matter? It matters because every individual is important, and the record shows that just in 2023, over 49,000 deaths from suicide. And this is a 36% increase from the rates as at the year 2000. And then for each of these deaths, we have approximately 10 ER visits, 48 attempts, and 325 thoughts. If you keep looking at the record, just in 2022, we have about 12.8 million people seriously considering suicide. And then from that number, 3.7 million made a plan and 1.5 million attempted. This is really very serious and calls for us to, take steps to prevent suicide. There are a couple of misconceptions concerning suicide, and then one of them is that people feel that if you talk about suicide, then you encourage it, but that's not really true because studies also shows that talking about suicide helps to reduce the thoughts. Some other people feel that people who are mentioning suicide are people who are looking for attention, but it's also not the case because many of the people who died from suicide actually expressed consent and no one listened to them. Some also said that suicide is preventable, but I know, they said suicide cannot be preventable, but that's not the case because, with timely intervention and treatments, we can save life. And then finally, one of the final misconception people usually have about it, they say that people who die from suicide are selfish or weak, but that's not the case because these people actually experience unbearable pain. That does not mean that they are selfish. What are the risk factors that could make us want to commit suicide? It could be mental health condition, pain, chronic pain, substance use, impulsivity, hopelessness and trauma. Some people are being bullied, or some people they lose a loved one, or they are isolated. Some people, even as not having health care, can make them want to commit suicide. And then also having easy access to legal means, on unsafe media, all this can tilt you towards committing suicide. And these are the things that surround our world. But the good thing is that we have some protective factors that can keep us away from suicide, and they are our effective coping mechanism and problem solving skills, strong connections with friends, family and community, our cultural identity and belonging, access to mental health care, and then reduce access to these lethal means and supportive beliefs. This can help us protect us from suicide. Also, what are the warning signs that we need to check out for those who are having suicidal ideation? Some of them are verbal cues, like talking about wanting to die, or feeling hopeless, or feeling being trapped, or you find them saying that there is no reason to live. Some could be behavioral, when they start going on the internet to research ways to die, or just suddenly isolating themselves. Or when you see someone giving his or her prized possession, you could also look at their mood. Some are depressed, anxious, irritable, very severe mood swing. When we see all these, they are actually warning signs, and it calls us to take appropriate step. And then how do we help those who are having this suicidal ideation? First of all is to ask them directly if they are thinking about suicide. Then the second step is to be there for them, listen without judgment and stay present. Then the third step is to keep them safe. Make sure you remove any lethal means or any means that could aid them to commit suicide. Then the fourth step is to connect them with the right resources, connect them with the suicide and Crisis Lifeline by calling the number 988 and other support network. And then the final step is to make sure you follow up with them, to keep showing support. So we have great deal of evidence-based treatment for suicide, and we should make use of them. And this evidence-based means include cognitive behavioral therapy and suicide prevention. We have the dialectical behavior therapy and medication management. We have the family involvement and planning. We have also treating suicidality directly and then alongside underlying conditions. For resources, just always call the 988 8824/7 suicide crisis lifeline. And if you have an urgent emergency, you can dial 911 and they will come to your aid. So recovery is possible. Early treatment saves life. Let us make use of the free and confidential support that we have. And then finally, you are not alone. Suicide is preventable, by dispelling these misconceptions, recognizing the risk and warning signs, taking actions, we can save life. Make sure you reach out to someone if you're struggling. Thank you very much for watching.